This is Dr. Carlos Diaz. Today we will speak about vaping in children with an emphasis on children with pulmonary disease. Vaping refers to the activity of smoking from an electronic device which heats thin liquids into breathable particles. These particles may contain nicotine, may contain fruity smells, and other things as tiny particles such as preservatives and propellants. These characteristics of vaping, such as the fruity smell, the lack of smoke, make it more glamorous, even appear to be a healthy alternative to cigarette smoking, but it is not. These tiny particles penetrate deep in the airways. Let's speak first about vaping in children and teenagers in general. In children and teenagers, the issue is that the children's lungs and airways are still not fully developed. They are smaller in size or caliber. Their immune system and coordination of the immune response is not fully developed yet. Children in general are more sensitive to the irritants produced by the vaping chemicals, causing inflammation and airway obstruction. They are more prone to suffer lung injury. So even in totally healthy children, the products of cigarette vaping can be harmful to a child who does not suffer from a pulmonary condition, irritating their airways and promoting them to develop respiratory symptoms such as cough from the inflammation. What about children who already have a pulmonary disease such as asthma or cystic fibrosis? These patients' airways are characterized by being hyperreactive or sensitive, and airway inflammation produced by vaping can cause an acute asthma attack. In fact, vaping has been associated with an increased number of visits to the emergency room, hospitalizations, more intense asthma exacerbations, and also a particular type of lung injury called EVALI, which is a lung injury in which the patient may develop acute respiratory failure with a well-documented number of cases who have required mechanical ventilation, being a life-threatening condition in itself. Our very strong recommendation is against vaping in children and teenagers. Also with a special mention about passive smoking. You see, vaping is considered to be as harmful as a second-hand product as cigarette smoking itself. Be sure that if you are the guardian or parent of a child with asthma, try not to vape around your child. Thank you. This is Dr. Diaz. If you have any further questions, leave them below in the comments section. I will make my best effort to answer your questions. Thank you.